like the practical aspect. So am I doing like a household survey, exit interview, focus group, participant observation? So all of that are the tool you are using to answer your question. And then the last step is the analysis. Am I doing descriptive statistic, regression analysis, content analysis, narrative case study? So you see all of that depend on the tool and the method, but also on the epistemology, on which what is my perception of knowledge and how I can better answer to the question I want to answer. So we have typically in public health and the social science, in most of the social science, that feed public health actually, because public health is not a discipline. So in public health, we are always using methodology and methods from different disciplines, from statistics, from economics, from anthropology, from sociology, from demography. So we use like methods coming from different disciplines. The two types of methods that are mainly used in public health and global health are quantitative or qualitative. You see, quantitative, if you want to count, you need to be counted, and it's something you will hear very often. If you want to get money for a project, or if you want to approach people, you need number. You need to prove that the problem is important, and you need to show what's happening in reality. Do we have like 5 cases of a disease, or do we have like 1 million cases? Then the situation is completely different. But at the same time, not everything that counts can be counted in Einstein. So we need to understand what's happening, why people are doing what they are doing. I mean, if I want to implement an intervention, I want to implement a new drugs, for example, for a disease, and then people are not using it. I want to understand why this is not happening. Or in the case of snake bites, you want to implement like the treatment at the health facility. I don't find the word. The treatment at the health facility to treat the patients. But if nobody is going to the health facility because maybe they don't know it's existing, maybe they are scared about it, maybe traditionally they use other type of treatment, you need to understand why this is happening to improve the efficiency of your research or of your intervention. So quantitative typically aims at measuring events. So information is translated into numbers. You answer in general question like how much, how different, and you can also define the factor that cause any outcome. In qualitative, you aim at gaining in-depth understanding of events. So information is kept as words, and you want to answer the questions why and how something is happening. So why people are not going to the health facility for my new intervention that I have implemented. How mother breastfeeding in some specific country. We are looking at that right now, for example, in the case of antimicrobial resistance, to try to understand how the transmission of pathogen and maybe resistant pathogen is happening during the breastfeeding. So we need to understand how is it going and how women are doing that. The tools available are very diverse. In quantitative, you know that, and you had course. I will not really focus on that. I will more focus on the qualitative, even if in social science we use both quantitative and qualitative. In quantitative, you can analyze existing data. So you can use, like, for example, register from health facility, data from HDSS, from DHS survey. You can do questionnaire, you can do observation. Yes, we can do quantitative observation. So you have a grid like a questionnaire, and you check, has the nurse measured the fever? Did the nurse ask what happened? Did the nurse ask which type of snake it was? Like so and so. You can have like a quantitative observation grid that you use. And you can also do cost and financial analysis. All of that are numbers. You will analyze them using different software. You can do it with Excel. You can do it with EpiInfo, Stata, SPSS, SARS, R. There are many, many options, and it's really up to you to decide which one you want to use. What I want to focus a bit more today is qualitative, because I think you have been trained quantitative, and qualitative is not like a larger focus in most of the training, and I think also in this summer school. So I wanted to give you a bit more like the tools that can be used in qualitative, and that are the typical tools that we use in social science. Analysis of existing material, observation, interview, focus group discussion. I will describe that a bit more in detail later. And what do we do once we have that? We have words, we don't have numbers. So I cannot from that define the causality. I cannot define the percentage. I cannot define the frequency. I really need from that to analyze the words, to look at the content, to look at what people are telling me. And there are also software to do that. So Atlas-TIA used to be the reference. Now people are using NVivo, but you have MaxQDA, you have many, many other more options that you can use to analyze the data. Quantitative was and is to a certain extent considered very often as a gold standard. So if we do research in public health and global health, people will consider that you need numbers, and quantitative are very important. But depending on the topic, if you work on sensitive topic, if you work on difficult to reach groups, if you want to understand the concept, the perception and cultural aspect of something, if you want also to see how your intervention will work in a real world constraints, so I mean, you can have like randomized clinical trial, double-blinded, and so that show that it's super efficient and this treatment is efficient for a disease. If people are not going to the health facility, if they are not receiving the treatment, if they are not taking the treatment, it will not be efficient. So we need to understand the perception that people have, the cultural aspect, the local context, to be able to understand some aspect, why an intervention is working or not. Also to explain maybe some numbers that you have, why in this region I have much more snake bites than in another region, for example. Are people behaving differently? What do they do? Which traditional treatment I use in this context? How is the healthcare system organized, that I can understand how I can implement my intervention. So very often now mixed method approach are used. So to answer these two aspects, once to get numbers and to get the extent of the problem, and on the other side, to understand better what's the situation, what's the cultural context, and what people perceive about what I'm doing. So as a qualitative researcher, you have a huge toolbox. So you have like 6 main methods here that I will describe. And there are many, many more. But once you know this one, you can imagine and think how to combine them. Mainly what we want to do with qualitative, we want to observe people, we want to listen to people, and to examine people's behavior. That's the 3 main objectives we want to do. The first method is document analysis. So there is an incredible wealth of data existing and documents. And very often you don't need to collect your own data. You don't need to restart a study. You can use, for example, like record from patients. You can use data from other study. You can use journal. You can use social media. I mean, it's a very, very powerful tool right now to look at Facebook or Instagram or Snapchat and analyze what people are saying about something. Any written communication, policy documents, social marketing tools, so anything that's written can be analyzed qualitatively. It's totally unobstructive. It allows you to acquire historical perspective and knowledge of the context. The disadvantage of document analysis is that it's not made for your specific objective. So you may not find exactly the data that you want to get. but it's like a very easy way to get access to data and to be able to have a first impression on something, or maybe do a full analysis on a topic. Sorry. The second method that's known is observation, and it requires some training, but actually some people are more like naturally inclined to do observation than others. So, but you can train. I mean, I'm doing a course here in Heidelberg, and we ask people to do observation also here. Like they have a specific topic, they have to take the train, the bus, to go to a restaurant or do something, and then to observe some body language of people, facial expression, non-verbal clues, behavior, so everything that you want to observe depending on your research topic. In observation, you have different level of researcher involvement in the activity. So you have a continuum between like non-participant observation to participant observation. So if you do non-participant observation, you are sitting there and just observing what people do. There is a very nice movie called Kitchen Stories, which is a very good example of what non-participant observation is and the danger and the risk of non-participant observation. So it's actually in Sweden. A study was done for by a kitchen company to try to figure out what would be the best kitchen for a single male in north of Sweden or Norway. And they install literally in the kitchen of the people a chair like you have in the tennis tournament. And in that, the observer was sitting in the kitchen of the people. So you can imagine how disturbing it can be to have someone sitting in your kitchen with such a strange chair like that. And that you cannot really collect the truth and the real elements. So we move from non-participant to participant observation. Participant observation means being fully involved in the life of the people. That's typically what anthropologists do. They are like living with the people, the village, doing the activity with them. It's called like going, sorry, I need to stop my phone. It's like going native. So people are really like living in the village, living with the people, and participating. If you want to do a study on like wedding ceremony and so, you need to participate. You cannot be there sitting and observing people. So it entails a willingness for reciprocal sharing of experience. It requires a building to the cultural ignorance principle. So sometimes it's easier to observe actually not in your own culture, but in a different one, because you see things that you wouldn't see in your own culture. And then there is always the researcher dilemma. Should I have to disclose or not disclose my identity? And how do I disclose myself as a researcher, being ethical on that? The golden rules of observation is train yourself to observe, learn to control bias, take systematic note of what you observe, ask like a journalist, ask who, what, when, where, why, how things are happening, and rely on key informants to make sense of situations and events you observe. So there are things you may not understand as a foreigner in a different country or in a different topic that you don't know, and so, and it's very important to have key informant that can help you understand what's going on. The third method, you probably heard about it already, it's called individual interview or in-depth interview. It's actually a discussion between an interviewer you see on the picture and a farmer that is interviewing. It can happen over several times. It's really interactive, so it's like a discussion with the people. It's suitable to address sensitive matter, individual choice, or when seeking in-depth understanding. So for example, you have someone who had a snake bites, and you want to understand the different steps this person took to get treated. Did they decide to go to traditional healer first, and then they go to the health facility? Why did they decide that first? Was it a money question? Was it distance? They didn't know maybe they could be treated at the health facility. So how things are going, you try to reconstruct the story with the person. It has also different degrees of structure. So it moved from semi-structure to like completely unstructured interviews. So if you talk with some who will present just after me, anthropologists do in general completely unstructured interviews. So they just go to the field and talk with the people. And so in public health, we have more tendency to go for semi-structure. So open-ended question, but like plan. So you have a list of questions that you have planned before and a list of topics you want to discuss with a person. It's most suitable method for key informants. So if you want to interview Ministry of Health, Director of Hospital, Director of NGO, like Director of a program or intervention, that's the best method to use in this context. Informal interview, as I mentioned, the question emerged out of the flow. So it's like a normal discussion like you would have with your neighbor or with a friend. So there is no structure, no wording that can be used. The strength is that it's really like you observe the people and you base a discussion out of what they tell you, out of what you feel from the person. The weakness is that it's very difficult to compare if you have a very large project with different people collecting the information. Interview guides, so that's what you use in more structured interviews. So you have a list of topics, of themes to be covered, but you can freely decide on the sequence, the wording on question in the course of the interview. So it's not a questionnaire, it's not fixed, it's not standardized. I can always change the way I'm asking the question. If the person answered already to the question C and D, I will not ask them again when I come there. So I'm just like more free in the way I'm working and I'm talking to the people. Here it's like the little flexibility. So you have a fully structured guideline. That's what's used, for example, if you have a large project with different interviewers, you want to have the question asked the same way to remove the interviewer bias. It's actually very little use because it removed a lot of the interest of using qualitative and in-depth interview method. But it's also possible to do it like that if you want. The fourth methodology is focus group discussion. So here you are not discussing with one single person, but with a group of people. You have a moderator, so someone like managing the discussion, and you have someone being silent observer and note taker. You also have an interview guide. Here you need more structure because when you have like a group of people to interview, it's better to have some structure in what you want to discuss with them. Here it's more suitable to have like community perspective, community norms, value, expectation, beliefs. So you don't want the story of one person. You want to understand what's the perception of snakes in this community, for example. How do people perceive it, and what are their traditional treatment, what are their fears, and so. And you want to have the community story and not like individual story. In both cases, interview and focus group, you need to establish an empathic relationship with a person. But in the FTG, on the top of that, you need to manage the discussion. You are a moderator, you have people in front of you, and you need to balance who is talking and when, and to make sure that everyone is participating in the discussion and you don't have someone dominating while other people are completely silent. Yeah, that I mentioned already. So in individual interviews, the knowledge is generated through the answer to the interviewer question. So it's the story of the person you are interviewing, while in the FGD, the knowledge is generated through the exchange of ideas among participants. That's an example of a focus group I've done in Burkina Faso, 6 to 10 people. Here you have a bit more. Preferably, they do not know each other, but it's not always possible if you work in a village. Similar background, you avoid to have the hospital director with some like nurses or other personnel of the hospital sitting in circle. And it's also useful to collect some social demographic information on the participant to be able to identify them. The challenge in all of that is like not to build sufficient trust with the people so that they really manage to speak with you. But also at the opposite, you can have people who speak too much, and particularly in the focus group, it can create troubles to the people. So you need also to be careful to maintain this balance, to avoid that the focus group has negative consequences on the participant. You need to keep aware of your own emotion and reaction. I mean, I used to work on a topic on coping mechanism for like financial difficulty. And very often it was due to the death of the person. So it would come like to very emotional discussion about death of a child or so. So it was like very difficult, and you need to be aware of that before you start the focus group. Additional challenge in focus group is not being able to moderate, let people be dominant or fully silent. And that both in in-depth interview and focus group, it's failing to probe or follow up on comments. So if someone tells you something, you don't have to say, oh, it's not in my guideline, I don't care. But you really have to react to the discussion and continue talking with the people and be able to react to the comments they made. Frequent mistake, remaining on one topic, interrupting the respondent, letting a good question drop if it's not answered immediately, so not like asking again, phrase question in a biased manner. I mean, I know it's a lot of information, but I wanted to put it on the slides so that you can have a look later in case you need or want to implement it. That's an example of qualitative methodology. So in a project I have done, so we did in the exit interview at the health facility, asking people about the treatment. We did in-depth interview 4 days after, so to see if people took the treatment as planned. And we also did key informant interview with health staff, health district officer, and staff of the health facility. And we also did observation of consultation and pharmacy. So you see how methods can be combined to be able to answer your question of interest. There are 2 other categories that I want to briefly to present. One is called free listing, pile sort, or rank order. And it's very interesting as a stimuli material. So if you want to explore a specific topic or cultural domain, you may ask the person, for example, I use it for food. You may ask the person to like describe all the category of food existing in their community. So you may have it even physically and prepared food already and have it there. And you can ask them to rank it into healthy and non-healthy food. Here in the case of the picture you have here, we wanted to do like a classification of the family from the poorest to the richest, because we wanted to give a subsidy to poorest family to access healthcare. And we asked people after a discussion, how many groups do we have in terms of poverty and wealth? How can we sort out the people, make groups so that we know who is really poor in this community, that we can give to these people a subvention, for example. A subsidy, sorry for the word. But this is like, you see, I give you 2 examples completely different. So this can be used in many other ways with many other tools. So you can be really creative in the way you use all this method in qualitative. You can use also photo narrative, visual aids, storytelling, body mapping. So body mapping, for example, you have one person that will lay on the floor and you will make the mark of the body, and you can ask, for example, where do people have reaction when they get like snake bite, or where do people have reaction where they get stressed, what's happening, and then people will draw on the body, or stress is making like my heart beat faster, my voice is changing, I have stomach pain, I have everything. So then it helps them like to develop. Here you see on the picture, we were using a wooden board with cubes. And we were asking people, it's a scale actually. We were asking people to put as many cubes as they thought was necessary to represent like the pain, for example. In this context, we were talking about their feeling about their own health. You can use narrative, so that's an example of prescription of bags of drugs that people receive and of a pharmacy. So to discuss with people, what do they think about it, what could be done to improve the situation, and so. And that's an example that actually of a project that we are doing right now. We are having a meeting in the community on antibiotics resistance, and that's very preliminary work. We are working with a cartoonist from Burkina Faso to try to develop some cartoons that we can use to stimulate the discussion with the people. So you see, everything can be done. You can be as creative as you want. There are a lot of possibility in social science and qualitative methods. Just a few words. I know I'm late. I just need 2 more minutes. I hope it's okay. About analysis. So the analysis is content analysis mainly, or thematic analysis in qualitative method. We want to organize non-structured information in a structured format. So I will not go into the detail of all of that, but the objective is really to extract the core message expressed in the materials that you have collected. So in the discussion, in the document, in your observation with the people. So you focus on the content, on what people told you. Actually, what we want to do is that there is a reality, there is a perception of the reality, you see it's slightly different, and then there is your description. And the objective is what we say and write about the reality should be like as close as possible to the reality. And there are many methods and there are many validity aspects that can be used also for these qualitative methods. Very often people think that qualitative methods are not as valid as quantitative and shouldn't be used or so, but there are many ways that we can use to validate the methods. Take-home message, the starting question guides the choice of method, and consider qualitative as well as qualitative methods. So depending on your objective, depending on what you want to do, understanding the perspective of the people, understanding the culture, understanding their traditional treatment, what they do in general is very important, and social science and qualitative method will allow you to do that. Thank you for listening to me. It was very fast and I give you a lot of information. I hope it was clear. I think we can have a discussion maybe after the second presentation.